What's going on? I'm Dr. Al and this is Bone Jovi. We're going to be going over stenosis, what it is, if physical therapy can help, and what you can do at home to start your therapy. Spinal stenosis is a narrowing of the canals. And what you can see is these little nerves that come out of the canals. And when these holes get smaller, it can start to encroach or get closer to these nerves and put some pressure on the nerves, which can send signals down the leg or even cause pain. Now, there's a couple common causes of stenosis. One of the bigger ones is degenerative disc disease. But what it is over time, as we age, as we fight gravity, these discs, so the little spaces in between the vertebrae or the bone, they actually start to squish down and get a little bit smaller over time. And that's what the degenerative disc disease is. And it can cause spinal stenosis, which will put pressure on your nerves. If you're getting value out of today's video, let me know by hitting that like and subscribe button. Now, you can get spinal stenosis just about anywhere throughout your spine, but the most common areas to get it is the low back. This is a common thing that I see in physical therapy day in and day out, and people tend to ask, well, what is it? Can I get help with this? You know, if I have decreased space between these foramen or these holes? And the answer is yes, you can. So there's muscles that go all around the spine. The big ones are the paraspinal muscles. And when these muscles are tight, what it can do is it can contribute or increase the pressure to the spine and in the areas where you already have the narrowing. So if we loosen these muscles up, it'll decrease the amount of pressure in the area. So the biggest thing that we can do as physical therapists, as patients, is to stretch and try and decrease pressure throughout the spine. Here's some exercises for you guys to try at home to stretch out those paraspinal muscles to decrease the pressure and pain. Let me know what you think of the exercises in the comments down below.
To perform double knee to chest, lay flat on your back, give your knees a hug, and hold for 10 seconds, 10 times. To stretch those glutes, grab and hold the knee and pull towards the opposite shoulder. In this example, I'm pulling my left knee towards my right shoulder. Hold for 30 seconds, 3 times. Don't forget each leg. Ball rollouts are performed seated with the Swiss ball. Roll the ball forward, hold for 5 seconds, then roll to the left, hold for 5 seconds, then roll to the right, hold for 5 seconds. Perform this 5 times. Alright, this one's easy. Bend over, touch your toes, hold this position for 10 seconds, 10 times. For a child's pose stretch, get on your hands and knees, drive that butt towards your heels, and tuck your pelvis down. Hold this position for 3 rounds of 30 seconds. To perform the pelvic tilts, lay flat on your back with your knees bent and feet on the floor, then rotate your pelvis back towards the floor as if you're trying to flatten your back against the surface. Perform 20 reps slowly.
Thanks for watching. Can't wait to see you in the next video.